Hi, this is Dr. James Vermilyea again from Cognitive Behavior Therapy Associates. I'm a licensed psychologist, and I wanted to talk a little bit about other types of OCD that we haven't mentioned so far. So there are a variety of different types of OCD. We mentioned that there are people who have OCD that have just pure obsessions, which they try to undo in their head. People who have OCD that have compulsions to go along with the obsessions, and they might, again, have a thought that's disturbing to them, but then do some kind of behavior, whether it's seeking reassurance, checking it out on the internet, doing a variety of different things, washing, cleaning, checking, counting, are all different types of things that people do, prayers, rituals, to try and make that anxiety go away. And these things become less and less effective over time. There are several other types of OCD that people can have, one of which is trichotillomania. And that's a fancy word for feeling like you want to pull out hairs or pick at yourself. So people will often, not have any eyebrows and have them penciled in. There are a variety of other reasons why that could happen too. Sometimes people in the past had their eyebrows removed or waxed or whatever, and they never grew back. So don't assume that someone who has, thin eyebrows or is missing them automatically has trichotillomania. But people will sometimes, they'll twirl their hair, they might bite on it. A variety of different things that people with trichotillomania do. They might pick at their skin repetitively until it really gets to be raw and red, even bleeding. And again, these are anxiety management techniques for them. Okay? So they're having some type of anxiety. Sometimes they can't even verbalize what it is, and they're engaging in the use of behavior, namely pulling out hairs or picking or worrying their hair to reduce that anxiety. Another type of OCD is hoarding. And hoarding is a type of OCD where the person often becomes homebound, but it's a very complicated disorder. Sometimes you might have seen this on TV. I know it's been kind of sensationalized. But the paradox is the person with hoarding starts to feel like they need to keep something in order to make sure that they're not throwing away something valuable. That seems to be the core thought most of the time. So people might save newspapers. They might even put things of value in the newspapers and then save the newspapers. So they might, for instance, take important documents or money, mail, those types of things, family photos, and interleave them with ordinary newspapers, and then the newspapers get stacked up all over the house, or magazines. People sometimes save food containers. You'll have a whole room full of jars or a whole room full of milk containers. So there are a variety of different things with hoarding that people do. Sometimes they just fill their house up with these things that they're kind of afraid to throw out. Other times they actually end up having to have auxiliary spaces, such as barns or storage rooms that are filled with things that you or I might ordinarily recycle. In extreme cases, sometimes people who hoard things hoard things that are kind of unhealthy to hoard, like spoiled food containers or other types of bodily fluids or something like that. Okay, and these things can combine to create public health hazards in some senses. So sometimes you'll find that people who have hoarding, end up having the Department of Public Health come and, clean their house out because they've got, 20 cats that they haven't cleaned up after in a number of years, or, have so many newspapers and things in their home, the fire department's worried that they wouldn't be able to get in if something happened, that type of thing. Cleaning out something that, against a hoarder's will really doesn't help them. Okay? Specialized behavioral treatment in the form of, again, exposure and response prevention is available for people who have hoarding. One of the problems is that often insurance companies won't pay for any kind of home visit. And this is terrible, but it creates a real problem for us in terms of trying to effectively treat people who have hoarding, because many times they've gotten to the point where they're not employed any longer. They're stuck in their home taking care of all these things that they've acquired. So that's a real treatment issue, and one that we're not quite sure how to get around many times. We do have some people that we can send out to people's homes who are trained to help them and help conduct the treatment in the environment in which they're doing these things. Office treatment is usually not very effective in the treatment of hoarding. And if the hoarder isn't interested in treatment, it's almost impossible to treat them. Family members often call saying that they have an aunt or a brother, sister, uncle, friend, whoever, who's a hoarder and is living in an unhealthy situation. But if that person isn't interested in really obtaining treatment for that, it's extremely difficult to force anyone into treating themselves for this particular kind of problem. So let's move on and talk about yet another type of OCD, and that's Tourette's disorder. So Tourette's disorder has a different number of, a variety of manifestations, let's say. One of which might be most popularly, in terms of the way people think about it, is shouting out or saying things spontaneously which they really don't want to say. So they might say something inappropriate in a quiet social setting, might say something at a funeral or in some type of meeting or religious event. And all of a sudden, they feel like they just can't not say something, and it's very inappropriate, and of course causes a great deal of commotion. People also can do this interpersonally, so that they'll be speaking with someone and they'll say something, and then they'll say swear perhaps, and then excuse themselves and say, "Oh, sorry, I didn't mean to say that," and then say it again. So it can appear to be very odd at times, but this is a type of obsessional disorder and can be treated. Another type of tic, and they're called tics with Tourette's, is a kind of motor tic in which the person, might have some type of, blinking, let's say, perhaps, where they'll blink and do that repetitively. But it's not necessarily a neurological problem, which it can be, and that's an important thing to rule out in the treatment of any kind of Tourette's, is that it might be some other type of involuntary movement disorder, such as Parkinsonism or some other thing. So a medical evaluation is always important, and important to have somebody that knows when that makes sense and when it doesn't. But again, these tics are really obsessive problems that the person is actually expressing these as a way to control anxiety. They're fairly difficult to treat. They're not as easy to treat as other types of OCD, but again, just another type. The last type that I want to talk about right now is called body dysmorphic disorder. Body dysmorphic disorder is a condition where the person has a great deal of anxiety that some part of their appearance might not be the way they want it to be. Now, people's insight into this varies. So some people know that what they're concerned about doesn't really exist. So someone, for instance, might say that they feel like they just appear hideous to themselves. Not just bad, like you or I would look in the mirror and think, oh, okay, Dr. Vermilyea is having a bad hair day today, or gee, I'm getting some lines in my face. These people think that they look grotesque. Okay, and sometimes people have insight into that and can say, well, I know that I really don't look that way, but when I look in the mirror, I see an ogre. Okay, not literally, but sometimes people feel like, in the extreme cases, that my nose is so bad that if the plastic surgeon can't see it and he won't do it, well, then I'm going to do something about it. And sometimes people actually cut themselves in various locations on their body, trying to do what people refer to as self-surgery. So body dysmorphic disorder usually, though, doesn't get to those heights. It's usually just a thought or a fear that you might have some aspect of your body that you think is just unacceptable to you. It could be the face. It could be sometimes with men that their penis they think is abnormally small, or people think that there's some kind of a disfigurement that they might have. Social kind of socially uncomfortable things about their body that make them feel like they need to spend a lot of time doing makeup or hiding these body parts to make sure that other people don't see them. So there's a great deal of anxiety associated with this, and this is another kind of OCD that can be treated with exposure and response prevention quite effectively. We don't have time to really get into the methods of that, but again, I think that if you've looked at all three of these blogs on OCD, one of the things that you can understand is that the types of treatments that need to be employed are very individualized. And that's one of the reasons why I've never written a book about these subjects, is that it's impossible to really try and generalize from what I'm talking to you about today and create an internal treatment that, or an individual treatment that's really going to be very effective. Most people don't have much luck with that. So if you need exposure and response prevention, you have to find somebody who's really very skilled and very experienced in designing these programs and in carrying them out. Okay, so it doesn't do to have someone read in a book how to do it and then try and help you with that. They really need to have special education in this area. So I hope that you've enjoyed this particular installment. Next time we will be talking about other types of anxieties. And thank you for watching.